Hi, my name is Eileen Knoll, and I'm a school nurse at an elementary school. And today I will be teaching about diabetes mellitus to first-year nursing school students enrolled in the BSN program. There are two common types of diabetes. There is type 1 and type 2. The objective for this diabetic lecture is to describe and explain indicators that may and can occur during uncontrolled diabetes. Describe and explain possible risk factors. Describe and explain physiological changes that can occur. The content of and learning process. Diabetes is a metabolic disorder. It is a chronic disorder of the carbohydrate, fats, protein metabolisms with long-term complications to blood vessels, kidneys, eyes, and nerves. Diabetes is also the leading cause of end-stage renal disease. In the United States, there were more than 25 million people, about 8% of our population, who were diagnosed with diabetes, with 1.9 million new cases discovered annually back in 2015. Diabetes was the seventh leading cause of death in the United States in 2015. The statistical rate of diagnosis by race and ethnic backgrounds are 15.1% of American Indian Alaskan Natives, 12.7% of non-Hispanic Blacks, 12.1% of Hispanics, 8% of Asian American, and 7.4% of non-Hispanic whites. Disease backgrounds include signs and symptoms and comorbidities. In your patients with diabetes, there might be more pronounced, subdued, or even absent signs and symptoms of weight loss, weight gain, polyuria, polydipsia, polyphagia, constipation, fatigue, cramps, blurred vision. Long diagnosed patients may be more susceptible to vascular disease such as coronary artery disease, heart disease, and peripheral vascular disease. Some major complications of diabetes can include dangerously elevated blood sugars, abnormally low blood sugars due to the medication, and diabetes and disease of the blood vessels, which can damage eyes, kidneys, nerves, and heart. Comorbidities can be obesity, hypertension, dyslipidemia, fatty liver disease, cancer, and fractures. Pathophysiology of the disease process. The hint is that insulin is the key that unlocks glucose to be processed in the body. Type 1 diabetes is when the pancreatic beta cells is destroyed, caused by an autoimmune process, usually leading to the body's inability to produce insulin. Type 2 diabetes is the impaired insulin secretion through a dysfunction of the pancreatic beta cells and impaired insulin action through insulin resistance. Insulin is needed sometimes. The golden standard for diagnosis is a periodic test called the hemoglobin A1C blood test, which estimates glucose levels in your blood over the last 3 months. It is used to identify overall glucose levels. Diabetes can be diagnosed also by blood glucose testing regularly and glucose tolerance tests. Diagnostic criteria for diagnosis of diabetes by the American Diabetes Association include a fasting blood glucose level of 126 milligrams per deciliter or higher, a 2-hour plasma glucose level of 200 milligrams per deciliter or higher, a random plasma glucose of 200 milligrams per deciliter or higher in patients with classic symptoms of hyperglycemia or in a hyperglycemic crisis. There are some common medications and mode of actions. Treatment for type 1 diabetes includes taking insulin, which needs to be injected through fatty tissue. With type 2 diabetes, the pancreas usually produces some insulin, but either the amount produced is not enough for that the body needs, or the body cells are resistant to it. Types of medication insulin are short-acting insulin. It starts within 30 minutes after injection. It peaks 2 to 3 hours, lasts 3 to 6 hours. Regular insulin is an example. Rapid-acting insulins act within 15 minutes, peak at 1 hour, and last 2 to 4 hours. Examples are insulin aspart and insulin lispro. Intermediate-acting insulins start 2 to 4 hours after injection, peak 4 to 12 hours, and last 12 to 18 hours. Humulin N and Novolin N are some examples. Long-acting insulin starts several hours after injection, does not peak, and lasts 24 hours, sometimes longer. Levemore and Lantus are some examples. They also have some combination insulins And there's also an oral medication called metformin. These medications can have drug interactions caused by prescription medications, over-the-counter medications, herbal products, or vitamins, diseases, food, and genetics. Expected outcomes. There is no cure for diabetes. Type 2 diabetes can be controlled through weight management, nutrition, and exercise and medication regimen. Diabetes can be genetic, but is more based on the biology of the individuals and their lifestyle. Environment and lifestyle to prevent diseases and complications are hemoglobin A1C checks every 3 to 6 months, yearly dilated eye exams, foot examinations at every doctor's visit, blood pressure checks to be kept below 130/80 to lower the risk of neuropathy. Lifestyle of a diabetic patient will have to conform to healthy eating, learning about carbohydrate counting, and portion sizes. Coordinate your meals and medications. Exercise regularly. Checking blood sugar levels frequently. There are times when cost of medications can be a reason for uncontrolled diabetes. Classroom and clinical learning. There will be a case study given to students today to break into groups and allow for team collaboration and brainstorming together. There was a pretest given before this lecture, and a post-test will be given based on the knowledge gained in diabetes complications and interpretations of results. There will be time allowed for questions from students, and encourage students to collaborate knowledge among each other and answer their own peers' questions. Evaluations and outcomes. Outcomes should include understanding ways to keep blood sugar levels within normal limits. Be aware of signs and symptoms of hypoglycemia and hyperglycemia. Knowledge that A1C levels must be checked every 6 months or less if A1C levels are above 7%. Knowledge of target blood glucose readings before meals should be between 70 and 130 milligrams per deciliter. Complications can be one or more, including heart attack, stroke, kidney disease, renopathy, and neuropathy. An evaluation of the post-test based on knowledge gained on diabetes complication interpretation of results must be passed with an 80% or better. Possible questions from students. In medication therapy, the only appropriate way to manage diabetes. No, proper lifestyle can assist in managing type 2 diabetes. Will the doctor have to adjust the insulin regimen to accommodate the patient's lifestyle changes? Yes, medication changes will be adjusted based on labs and glucose readings. Should the patient be seen by a PCP more often to be closely monitored? Initially, patients need to be seen by PCP more frequently until glucose levels are within normal limits. Should patients participate in physical activity? It is encouraged that patients with diabetes need to be active. This can help a patient manage their glucose levels. Will an adjustment of carb intake affect blood glucose levels? Yes, insulin injection is based on the amount of carbs a patient plans on intaking. Conclusion and link to objectives. Students will be able to list indicators that may or can occur during episodes of uncontrolled diabetes. They will be able to list risk factors that can contribute to further complications of this disease process. Students are required to label changes that occur physiologically. Diabetes is a completely manageable disease with proper routine, regular scheduled doctor visits, properly educated on the disease process and treatment and medication regimen. Diabetes is a very serious disease and can lead to death. Please use your knowledge and education to help halt the complications from this happening. Thank you.